Welcome to Creative Health Tech, your dose of strategic creativity from the minds pushing the boundaries of the health tech industry. We are your hosts, Felippe Silveira, and with me is Half Marks. We're the founders of MOE. And on this episode, we dig into the strategic role of marketing in scaling health tech products for different audiences. Joining us is Jeff Hortman, the Senior VP of Marketing at Well. So yeah, Jeff, so welcome to the show.
Yeah, thanks for having me on. Really appreciate it.
Awesome, happy to have you here.
Yeah, something like we always like to start asking everybody that we invite is how did you start? Also, like a little bit about Well, and how was the experience of helping build also the company, because it seems that you are working there almost from the start, right?
Yeah, absolutely. Well, I can give a quick background there. We're going to be talking about health tech. I have to first say that I haven't always been in health tech. I actually started my career as a screenwriter, and I was developing television shows and films in Los Angeles for a number of years, but really found a passion for that storytelling could translate into other industries. And so I ended up getting more involved in digital consulting. So helping companies tell their stories, nonprofits, large companies, startups, things of that nature. And eventually found my way to Well, where I was connected from actually a former client relationship and had consulted in health and digital health a little bit, but this was really a full jump in with Well, and I've been with Well since the very beginning for about 6 years now, which has been really great to see the various stages of growth that the company's had, and we can certainly talk more about that, but Well in general is trying to solve an engagement problem with health. And it's trying to do that using a couple of specific levers, but they're all in the digital realm. So Well offers an app. There's also a website that accompanies it. And within that app, an individual can find multiple different things related to their health. They can find content they can engage with. They can find their health benefits listed in an intuitive way. They can reach out and chat with a human who can give them guidance about various aspects of their health. And importantly, accessing the healthcare system, which as we all know in the US, can be more complicated than it needs to be. And the way that we wrap this in a unique way is that we are not afraid to use incentives. So we have a very robust reward structure that encourages people to do that next best step for them. And we have baked in a series of AI models into the basic fabric of our company from the very beginning. So in the last year or two, I think everybody slapped AI onto anything related to
Yeah,
health, and that's all well and good, but this is really a basic DNA of our company from 6 years ago. And so it's been somewhat amusing to see folks slapping AI onto everything of late. But our personalization models are very much geared towards the marriage of engagement. So monitoring the life cycle of engagement so that our users are staying engaged with their health, staying engaged with us as a conduit to their health, as well as the assigning the next best step for their health in the right moment that they need it. So that might be recognition that you have a benefit that could help in a moment of need. It might be a recognition that you want to help or you've asked for help in a certain health area, say exercise, right? And we're able to give you content that might help with that. We might know through your health profile that you are actually overdue on a very critical screen that you need through your health. So we'll be able to suggest that in a way that makes it approachable, and also offer to assist you in navigating towards the right place of care.
I like what you said, especially in the part of the AI. That like you said, the last 2 years, I would say that putting AI in front of the product has been part of like a I don't know branding and marketing strategy. And you mentioned you guys, of course, you had AI running for a long time. Well, many companies they had AIs running on the background for a long time, but now it seems like it's a kind of a buzzword or something that attracts people. But how have you seen from a marketing standpoint, especially with this change that we mentioned, like how much you see the AI as a term being received by the consumers, and also like if something changed from the way you used to communicate before this boom of AI as it is right now.
Yeah, I think it's a great question. And AI is such a big world, right? I think that at the end of the day, AI is really just math. I think a lot of the buzzwords that have bubbled up lately are really applications of generative AI, which is something that we are exploring. But Our content is not generative from an AI model. It's built by clinicians. And so we actually think that credibility is something you want to maintain for now. Our AI is really focused, as I said, on personalization of the experience. So it's more akin to the AI that you would get from, say, Netflix or someone of that nature, which really allows us
Yeah.
to personalize each experience to an N of one based on what we know about you. And so, as far as we message that, it definitely has become a bigger part of our messaging to potential clients. So, our sales model is that we sell into employers who then provide our product to their employees as a part of their benefit package. It's our primary model. There are a couple other models where we go more direct to consumer. But as far as changing that messaging, I think initially, um, people were really interested in the concept of AI, but they maybe didn't have the patience to really understand the nuts and bolts. Now that it's much more in the conversation, I think that we found in our sales meetings more of a hunger to really understand. Okay, so how are you applying this, and in what ways, and tell us a little bit more about that. There are certainly concerns about AI, particularly in a sensitive area such as health. Will it be discriminatory? Will it be suggesting things that wouldn't be recommended? And so thankfully, we're able to walk through the guardrails that we have in place, all of our clinical pathways, which AI helps to assign to a member. All of those pathways have been vetted by clinicians. So we're very clear about the guardrails that are in place. From a consumer standpoint, we haven't really messaged more about AI. The words that resonate with our consumers are personalization, right? Because however you get to the personalization, most consumers don't really care as long as it's true
Yeah.
personalization. I think
Yeah.
the issue at hand is, especially in digital health, people use the word personalization, but it's a different level of expectation in digital health than it is for, say, consumer industries. I already used Netflix, but Netflix, Spotify, Amazon, any of these, the level of personalization you get is really detailed and helpful, right? In digital health, sometimes people will put your first name in an email and call that personalized. And it's just not exactly the same level of expectation. So trust is huge. And anytime AI is around, trust, elements of trust, you need to make sure you message very clearly and transparently about. But for our consumers, those have always been key pillars of our messaging, is to fully explain why we are credible and trustworthy, how we're handling any of your health data, and then also to explain that the majority of our efforts are about personalizing your experience so that you have a more engaging experience, which our data shows the more engaged you are, the better
Yeah.
health outcomes you will have.
Yeah, it makes sense because like you were saying, the AI, the way you use AI is with this personalization, and in the end, what the clients, the consumers, they care more is the personalization aspects than the AI aspect. And sometimes companies just throw AI because they think they're gonna catch some people that are interested in it. But especially when you talk about like health and like you mentioned, where you put the guardrails to AI, and because there are a lot of like debates and discussions, and we still don't have like all the rule sets for limitations or not of AI. So I see this can be seen both ways depending on who is in touch with the information. This can be either good or bad, but focusing on, like I said, the messaging on the personalization aspect, which is what I do, is way more powerful than just relying on a trendy word that is going on right now.
I think that's right. I think it makes it more approachable. I think it makes it actually useful to the user. At the end of the day, I don't know, is it useful or not? Tell me, how are you applying it? Make it about what
Should be
I'm getting
scared
out of
about
it.
it or not.
Yeah. How should I react?
Yeah, but like, what I feel that at the end of the day, everybody's looking for a good product experience and customer experience, and I feel that like the thing about personalization is that it's more than just you can have the app in yellow or blue, because like gamifying is also something really difficult. Each person has a different kind of thing that attracts them. Some people are like games, some people are more into rewards. So like if you can personalize their experience, you can be able to like, okay, this person works better this way, this person seems to be acting more this way. And at the end of the day, like if you're dealing with health, the amount of data that you have also to inform the, let's say, the AI or the algorithm or any kind of intelligence that you have built around that, is what probably creates the experience that people usually have and kind of attach to well.
Think that's absolutely right. What makes health so different is that everyone's health is unique, right? Whether it's your health profile, your health needs, your lived experience that might be informing that, your interests, where you are on the continuum for being interested in change, barriers that might be introduced for you to take action. All of these things are quite complicated. They're very different models to think about. And for the three of us right here, all three of us would have very different answers to that, right?
Exactly.
And
Yeah,
For sure.
definitely.
and so it's a great use case for AI in a personalization context because as a marketer, you wouldn't be able to heuristically come up with all of those different permutations, right? That it's a great example of where AI can be applied with the proper guardrails, to great success. And going back, I guess, a little bit to the conversation about messaging and what do people care about related to AI. We've really found two key points. I mentioned the guardrails. All of our workflows are built by clinicians, right? That's important. People want to know that what you're providing them is credible, right? And it's been vetted, right? This isn't a hallucination from a Gen AI, right?
Yeah,
Uh,
yeah.
and then secondly, they really want that human touch when they have a specific question. And so, chat bots or, AI chat functions can be really helpful if you're, very targeted with specific answers or, say scheduling. But if you really are trying to work through a problem or say set a new goal and you need to kind of talk through different permutations of it, having a live human on the other end that provides that empathy, that provides that warmth is something that we found is of high value to members, even when they're not using it. Just knowing that it's there helps them feel like they're being taken care of a little bit.
Yeah, because also like I feel that like whenever you are interacting with the kind of any kind of chatbot, you're expecting something that like I have an issue that I'm trying to communicate the issue that I have, and if you say something and you receive one of those pre-made answers that literally don't get you anywhere, you get way more frustrated if you're just looking for a knowledge base or anything like that. It's almost like it's giving you kind of this perception that you're having something custom and that you're having somebody hearing you, but at the end of the day, it's just a mimic. You're just talking with another robot. Yeah,
Completely. At the end of the day, what it does is it breaks your trust, right?
exactly.
It breaks trust. And within health, trust is so important.
So important.
And we've seen within the US healthcare system that, when you have that frustrating encounter, when you feel like you're just being treated a number instead of a person, it breaks that trust. And it really, results in people, bowing out of the system or not getting the care that they might need. Right. And so we've really tried to emphasize that with our experience is to honor that trust and to not break that trust, which, to your point, a chatbot that isn't designed correctly can very quickly erode that trust.
And kind of a curiosity that I have is that like everybody that we interview, everybody came from a different background. We have a lot of people that came from actually the advertising world, and you have a different kind of perspective as well. So I'm a little bit curious, like, what are the things from your consultant days that you feel that like you have adapted, or like some of the lessons that you have learned that you brought to the health space?
Yeah, of course. And I might also expand it a little bit just because well as a team has actually come from some really interesting places. So I'll tell a little bit of mine and I might share a few stories from friends too. But yeah, from a consulting background, I think the biggest thing or two biggest things that I've brought is number one, the importance of storytelling, particularly for an end user, knowing your audience, knowing how to craft and share a story that fits the right format that the story is being shared in, but also really addresses the audience needs. Like, why do I care? Right. I think a lot of times in digital health, the story ends up being written from an expert's opinion or from someone who's really been deep in the benefits world for quite a long time. And the vast majority of the end consumers are just not that's not their background. That's not their context. So really making sure that the story you're creating fits the purpose is key. The second thing is user research, right? Really caring about the member experience. And, I think this is something that's very typical for technology companies, but in the health space, it really, at least in some of the spaces that I've been exposed to, it wasn't as advanced. There wasn't as mature of a function or frankly, a value placed on it. And so I think that that's an aspect that not only myself, but several other colleagues have really fought for and done some great work in the user research, both qualitative and quantitative for member mapping and understanding, core desires. Other folks on the team that really have brought unique experiences and viewpoints. We have, I'd say, about a third of our team has come from a more traditional kind of health background. About a third of our team came from, I'll call it management consulting, or maybe other types of industries with a business background. And then another portion of our team actually came from the gaming industry. And
Nice.
so this is
Makes
where a lot
sense.
of
Yeah.
our deep expertise in gamification, incentive
Yeah.
design, finding the efficient frontier for being able to deploy those incentives to get the correct people to go do the correct thing for the correct amount of incentive really comes from. And it's just a very unique approach. I think sometimes when people hear about gaming and health, how do those two things mix? But in practice, they mix quite well because at the end of the day, it's really about designing incentive structures and programs that are going to be most effective at influencing behavior.
Yeah, because in the end, gaming is like I said, is a design strategy in a way, the gamification and how you keep users engaged. And you can use this for the good or for the bad. We have like social media is full of gamification and things that trigger, give us rewards and a lot of the stuff. But the good thing about like applying gamification to health, the digital health products is this. Like if you get users to continue using this, get progress on the health, we're not just getting people to use an app, we're actually helping them to see the benefits in their own lives. And I feel that's really powerful when you have that in your hand and you apply to something like a digital health product.
Absolutely. Yeah, I think, for any of these industries, right, they're using these designs to capture engagement. So whether it's gaming or whether it's social media or whether it's health, that what you're doing is grabbing engagement. And then to your point, what do you do with that engagement? Right? Once you have it, what is your objective after that? And I'm very happy to be working in a company where very truly the goal, once you have that engagement, is very altruistic. It's okay, great. How can we help improve this person's health?
Yeah, awesome. And Jeff, before you becoming the senior VP of marketing as well, you were the head of consumer experience, right? How was like working closely with the consumers? How that influenced your decisions in marketing later on when you moved to this position? Because in the end, from what I see, like you had a kind of an experience of being like more closely in touch with the consumer, and now looking for the overall branding and expansion of the company. And what are the things that you drove from that experience that you see that made a difference in marketing for well?
Yeah, absolutely. Yeah, I'll say that my role at well over 6 years, as it happens with many startups, has changed, right? But I would say
Yeah.
it's been more of an evolution rather than like a big switch. And so I actually still work a lot within the consumer experience function. And so it's really been more of an evolution than a big switch. But I will say that starting with that emphasis on consumer experience, because we didn't have anyone to market to for the first year, right? And so
Yeah.
that first bit was really focused on research and what messages should we be using? How are we going to create our narrative? It was critical. I think in that first year, we interviewed over 100 individuals. We had survey responses from tens of thousands of people. And that's continued at a similar pace each year as we've moved on. And so having that foundation allowed us to really, going back to talking about creating the right story, it allowed us to create a fresh story and to really anchor the messaging that we were trying to use based on what we'd heard from potential users, as opposed to basing it on the way that the rest of the industry tends to communicate about these types of benefits. Now, in some cases, you do have to lean towards some of that language that is known, just because it's almost become a certain taxonomy at this point in time. But for the most part, we really do try to create a story or a narrative or a messaging framework that more closely ties to what we've heard directly from members, whether through survey data or qualitative interviews.
Like, I feel that that's really important because we usually say that, like, working with health tech is quite difficult because sometimes you have the tech side that is usually really complex depending on which kind of device you're using. Also, you have the health, which is also quite complicated, not only because of the jargons and the complexity of health or medicine, but also sometimes the message that you're talking, like if you're talking about health, a lot of times you're talking about like sensitive topics. You're talking about diseases, you're talking about problems. So, like being able to communicate in a way that you don't like you can deliver the message to the person, make them feel at ease, give and build trust. That's fundamental. But that's also something that a lot of times people don't forget. Like think about user experience. It's just is the app beautiful? Is it working? And so like it's way more into product design rather than marketing. And sometimes marketing also forgets that part of the user and the consumer experience this is the way that communication is built, not only when you're trying to sell, but while you were with the user as part of your user base. So I feel like the way that you have envision all of this, not only like in the former job, but also nowadays as a senior VP, clearly show like you have this idea that like it's clear like communication needs to be a priority, and I feel like that's why you are so successful today with well.
Well, we have a lot of folks at Well who are thinking about this problem and chipping away at it every day. And you kind of mentioned the difference between like aesthetic, right? Like kind of more product design type
Yeah.
research, right? And our product team is fantastic, and there's several very talented members of that team that focus on research more from a product standpoint, right? And it's more akin to what you've kind of mentioned, right? And we have a good amount of overlap and shared knowledge, but yeah, I do think that there is. I think that it's good that we have both groups thinking about user research from the vantage point of what their teams need to really inform. I think that sometimes you see organizations where the research, goes all the way to one group or the other. I actually think it's been very beneficial for us to have two different groups who are capable of researching because, to your point, I think that it's allowed us to zero in on the story, and the messaging, and really the motivators that would still be apparent for individual product features, but you'd look at them in a slightly different way.
In the case of well, like you have in the end like um two two markets in the end to target. So you have the employers, you have the employees. How is your marketing directed to? Do you have to try to attract both? Is this more focused on the employer and how this messaging? Because we're talking, of course, a lot about storytelling and all this, but at the same time, when you have like this diverse audience, it can be hard to create a consistent line of message that can appeal to both of them. And how do you guys like solve this as well?
Yeah, it's a great question, and it's a really it's a big challenge that we think about a lot. I think right now we have sidestepped it a little bit, mostly because we have not invested a large amount into our external presence, so public presence. So anyone wants to check out our social presence and things like that. It's not much, right? And that's been on purpose because we haven't needed to invest in that yet. We mostly find our client prospects through other channels. It's not mass marketing. Consumer marketing is we know who our eligible population is. So we don't need to be trying to find people through more mass market channels. There will come a day when we need to do that, and it'll make this
Yeah.
question or this challenge a bit more precise. But for now, we are able to really market to the two different audiences specifically. We do run into some challenges like with our website where, okay, which portions of the website are marketing to the different audience. But for the most part, we have been able to really zero in on consumer marketing when we know we're talking to that individual, and then focusing in on the client or the employer messaging when we know we're speaking to that individual. And thankfully, we are marketing when we're marketing to the employer, they are very in tune with what their employees want, right? They are also consumers themselves, right?
Yeah.
And so thankfully it's not it's not completely different messages. Now, the employer clients tend to be a bit more sophisticated. They tend to be a bit more in the weeds on benefits and the package of benefits they're putting together. So we definitely need to get to a different level of detail. But at the end of the day, and there are a couple needs that we're solving for the employer, that we aren't necessarily solving for the end consumer. But a lot of the key themes remain similar, right? Personalization, the idea of incentives, right? Building that base of trust, having a whole health type of approach where it's not, spot solutions in all these different areas. So that leads to centralization and convenience. All of these themes resonate for both of those groups, which is helpful.
And it seems a lot comes from what I can understand as being, let's say, the foundation for you all, that is knowing, understanding, your customers. So like you said, a lot of the, initial years, like your research, interviews, and all this. So it seems like you can get a better understanding of what to say, to who to say, because you care about like knowing about the customer first before putting something in front of them. So it seems to be like instead of like creating a product and putting in front of a lot of people, you hear the people first to understand them and you make sure you are giving them what they are asking. Is that right?
Yeah, I think that's exactly right. And you don't always have perfect data, right? You
Sure,
try and get
sure.
Yeah.
the best data that you can, and potentially with employer clients, right? It's more challenging to get the data, to back that, right? Because you can't really spin up a survey necessarily of that audience as easily as you could with the end consumer. So it ends up being a little bit more, kind of being in those conversations and receiving the feedback from it. And that's why our growth team is really experts in that audience and what that audience needs. And from a marketing perspective, we really just support their vision and a lot of their direction on which way we should be going.
Yeah, and Jeff, I see you talk a lot of times about storytelling, and well, storytelling for us at Moe, it's really important. It's the basis of what we do here as a creative studio. And what are the things that you see that health tech companies in general they are lacking off when it comes to storytelling? We mentioned, of course, some stuff here, but what do you see that if more health tech companies start to do this in storytelling, they'll be able to reach more people.
Yeah. Yeah, I think there's a couple aspects of it. I think that one of them is really around authenticity and the human element of the story. We've all read stories or seen movies that felt like they were just from a template. Like, okay,
Yeah,
clearly
yeah.
I've seen this one before, right? And to make a story that really resonates, you need to make it authentic, right? It can have a similar structure, but you need to be able to make it something that feels real. Within health, the human aspect of health is so critical. And that's true from, the provider that you might be getting something from to your own health journey and how everybody's health journey is specific to them. But you need to make sure that that authenticity and that human quality, really shines through. And I think that's probably the biggest thing that I see in other types of literature and stories that are told in the health world is that sometimes it feels a bit boilerplate and like a template, or we're using jargon that everyone else uses, but the jargon's almost lost its meaning at this point in time. What do you actually mean by that? And it might make sense for someone who's worked in benefits for their whole life, but it likely isn't resonating with the end user. And so yeah, I think that would probably be the biggest, or the yeah, the highest point of leverage that folks could really focus on to try and improve those stores.
That's awesome, and I agree 100% of this.
Yeah, and like a question that I have is that like we have talked about AI, that you guys have been on this since way before it became a buzzword. Also, you're talking about personalization and storytelling. Where do you see the like health tech is missing, or like what do you see that is the next in terms of marketing, the creative side of health tech? Where do you see that like we are going the next couple of years, or what we are missing right now?
Well, similar theme to what we were just talking about, the idea of authenticity, right? The idea of bringing human stories to bear. In health, this is challenging because of PHI, and we don't want to be sharing everyone's information. However, what we have found really resonates is peer-to-peer messaging, right? Peer-to-peer stories, hearing how someone else has dealt with something similar, or even just hearing that, hey, I'm really enjoying this app, and here's a testimonial that appropriately deals with PII and PHI, right? I think that this is a huge opportunity for marketing. It needs to be done in a responsible way, right? But I think that,
Yeah.
not dissimilar to other industries where you see, peer reviews being huge levers for motivation. This is something that is not being fully tapped into right now. If you do look at a few companies that I think have done a pretty good job with it, Noom is one who does leverage a lot of testimonial use cases, and they're able to, because not that everybody's journey with Noom is the same, but it's a little more targeted on a specific type of health experience. I think
Yeah.
for folks like what Well is doing, that's a bit of a broader spectrum, being able to scale that, right? And being able to have testimonials and member stories that are resonant, but also relevant across a wide variety of use cases. That's an area that I'm really excited about because I think it taps into all the core tenets that we've seen resonate: personalization, authenticity, that human element, these pieces that really, and it builds trust too, knowing that someone else,
Yeah.
you're not just being told that this works, right? But someone authentically is sharing their experience, and that credibility is worth a lot.
And also, like, what I feel is that when there's somebody that is not a doctor or that is not into the health tech world, when they communicate differently. They communicate almost like human language. It's a little bit easier for people to trust, for people to grasp. So I completely agree with you.
Yeah, they naturally kind of filter all the jargon out, don't they? Yeah.
Exactly. Yeah.
Yeah, exactly. So Jeff, I want to thank so much for sharing your experience with us. Like, I love to learn about. You mentioned storytelling, personalization. I think that's definitely key for any good marketing strategy. And if anyone that is listening or watching us wants to connect with you, where should they go?
Yeah, you can absolutely reach out to me on LinkedIn. It's just Jeff Hortman. I guess I got in early, so you
Nice.
can find me there. I'm not the best at responding, but I promise that I will do my best. And of course,
Everyone
you can
Perfect.
check
everyone
out.
knows that.
Yeah, exactly. And of course, check out well.co. And yeah, if there's ever any interest from employers, feel free to reach out to us, and we'd love to have a conversation.
Awesome. So thanks for joining us. Subscribe to keep up with our next episodes. And if there's someone you'd like to see here in the podcast, let us know at cht@moe.studio. See ya.